My name is Cheryl. I am retired and enjoying every minute of it. I had my first SI joint fusion done in January of 2021 and the second one done in March of 2022. I was approximately 5 years out of a second lumbar fusion and I started having pain again, a little bit lower than where I had it before. The pain would escalate into throbbing. Sometimes it would be a burning, stabbing pain. Sometimes I would have an ache, but it was an ache that I would almost feel like I had bone grinding on bone at times. My pain affected my life with everything. It took away my gardening, which is my therapy. It took away my enjoyment of walking my dogs. When you're in a lot of pain, it's hard to concentrate on what you need to be doing. And it wasn't getting any better, so I came to see Dr. Kasow.
Hi, I'm Dr. Douglas Brian Kasow, board certified orthopedic spine surgeon who practices in Atlanta, Georgia at Piedmont Orthopedics, OrthoAtlanta. The SI joint is the sacroiliac joint. So the S is for sacrum, the I is for ilium. When I see patients in clinic and I suspect the SI joint as a pain generator, it typically is localized to the buttock region, sometimes around the hip and the groin, and down the leg, suggestive of nerve irritation. SI joint pain can be actually more common than what we suspect, and the prevalence can be 15 to 30% of chronic low back pain. Patients who have had a lumbar fusion oftentimes can have a recurrence of their symptoms or even a new pain as the load gets transferred more to the SI joint, and it can be up to 43% of recurrence of new pain following a lumbar fusion can be the SI joint. So when I see patients, my initial goal is to talk to them to try to really elucidate where I think their pain is coming from. Then I'll perform a physical exam, which can include palpation as well as different provocative maneuvers to try to elicit where I think the pain is coming from. And again, that could be the hip, it could be the low back, it could be the SI joint. And once I feel like I have a good grasp of where the pain is coming from, then I'll order objective tests and maybe even an injection.
We first started with physical therapy. It didn't help any whatsoever. I went through physical therapy several times. I did have the injections done. I would get some relief from the injections, but it didn't last very long. I would maybe get a month out of them, and then we'd have to proceed and do it again. Once I had decided to have surgery, I had already started doing some research. I did go to the iFuse website. I have to say that website gave me much more information and help than any other places that I looked on the internet. I knew that it was time for me to have this done. However, I ran into a glitch because the insurance company I was currently with refused to do it. iFuse really went to bat for me. I think they tried 3, possibly 4 times to get this insurance company to change their mind and how necessary it was. I did end up having to wait until I could go on Medicare, as Medicare did cover it, and United Healthcare covered it as well. So that is the plan that I went with. Once I got on that, we got that surgery scheduled.
I use the iFuse implant, which is a 3D printed titanium threaded implant that I believe provides the best biomechanical stability for the SI joint. It is one of the most gratifying procedures that I actually perform in spine surgery. It's truly been a change for my practice for the good.
Recovery was very easy for me. It's different with everybody, I know. I was able to go back to playing in my gardens, which I loved, walking my dogs, going to parks and walking them. I do a lot of cooking and baking that I stopped doing for a long time, which I enjoyed, especially the baking part, and my husband was happy to have that too. So I feel more like a person again, and an independent person that I can do the things that I like to do. iFuse definitely gave me my life back.
If you or any of your loved ones are having the complaints and pain that we have discussed here today, please feel free to contact me at Piedmont Orthopedics, OrthoAtlanta, and I'd be more than honored to see you